Ambassador Dr. Manoj Sharkapura.
Thank you very much. Respected Chairperson, Professor Shah Munir Hussain, ex-Director General, Health Services, and also who is the pathologist and public health specialist and who is working in the development of health system in Bangladesh. Respected special guests and the dignitaries in the dais and all the participants from Bangladesh, India, Thailand, Turkey, Iran, Malaysia, and also invited guests, ladies and gentlemen. Today is the birthday, 77th birthday of our Honorable Prime Minister, Sheikh Hasina. I pray that she should live long, and happy birthday to our Honorable Prime Minister by giving claps to her birthday. You are now sitting in Bongomata Sheikh Fojilatunnesa Mujib Convention Hall. Our father of the nation, Bongomata Sheikh Mujib and his wife, both has you see, our Honorable Prime Minister is the daughter of both of them, and our university is by the name of our father of the nation, Bongomata Sheikh Mujib. I pay my deep respect to our father of the nation, Bongomata Sheikh Fojilatunnesa Mujib, and all the martyrs who sacrificed their life during liberation war. And during our liberation war, India, Bhutan, Nepal, and other countries who sacrificed and also supported us, we are grateful to them, and always we remember their sacrifice. Today, this type of Bangladesh International Expo for healthcare, which have been arranged, I thank the organizers, as because only some of the hospitals will not be shown here. There will be about 8 symposiums on which we will be able to learn about the ROP, robotic surgery. There will be for bone marrow transplant and also knee replacement. Also some of the subjects on bone marrow transplant, scientific symposium on colorectal cancer. Also there will be some symposiums on cardiac and neurospine symposiums. I think all these will be very much helpful for the future specialists of Bangladesh, that is the residents as well as the specialists who can share their knowledge and disseminate it. I heard that during this expo about 14 renowned persons in different fields, they will be awarded. I am also very much thankful to the organizers that you have managed this type of activities, and in future I will have some suggestion that not only the hospitals from outside country, in our country there are many hospitals, they can also participate together and they can also share their knowledge during this expo. That will be very much helpful. You will be astonished to know that some of the people from Saudi Arabia, they came to us. I am the ophthalmologist, they operated phaco surgery. The plane fare as well as the operation charge is less than Saudi Arabia. So we can also have this health tourism that they can come here. Our neighboring countries like Nepal, Bhutan, Sri Lanka, they can also come here. Why they will come here? You all know, Bongomata Sheikh Mujib Medical University is the postgraduate medical university. All the postgraduate students are being admitted here. Now, you know the Prime Minister of Bhutan, he was graduated from Bangladesh. And now the cardiologist head, the ophthalmology head, they are graduated from Bangladesh, now in Nepal and Bhutan. So, we are giving we are making the specialists. But why we cannot treat the patients of other countries? Many patients go abroad. they don't know that the facilities are here. We have a experience that there was a research for the kidney transplant. You know, we have the rule about with anyone and they operate there. The cost is about 40 lakh, but in my country it is only 3 lakh. So for each kidney transplant, about 37 lakh are being given extra outside the country for the treatment. And do you know, about 17 lakh people are transplanted from abroad, which is needed of as because there is a kidney failure. In our hospital there is the kidney transplant, in our university there is the liver transplant, there is the bone marrow transplant, stem cell therapy, there is the treatment of infertility, but many people do not know and they go abroad. So I think in future, what is going on in this building, that should be open to everyone of our country also. You all know that the postgraduate doctors, every year there are 1,000 doctors are being admitted. 5 years there are 5,000, and in our country, the specialist in Upojala, a specialist in district level, and also in other medical colleges, the postgraduate doctors are being produced from Sheikh Mujib Medical University. Most of the postgraduation. And if we don't produce, medical college will be stopped. There will be no consultant in district and sub-district level. So the university is doing a lot. Not only the service, not only the education. You see, in our country, the development is also going on by our Honorable Prime Minister. Padma bridges have been made. The patients from Madaripur, Faridpur, Gopalganj, they are coming directly within 1.5 hours. And they are taking treatment from our hospital and they are going back on the same day. So the development of the country can also help the development of our health delivery system. There is the station in Metro Rail of Sheikh Mujib Medical University. After 2 to 3 months, I think from Ashulia or Uttara or from Motiji, many patients will come. As because the patients are being increasing for the development of the country, and I hope this development should continue. Our hospital has at least 57 faculties and departments, about 500 faculty members, and there are 8 faculties and 8 deans. In this hospital, we are performing the medical education, we are performing the health delivery system, and also the research work is going on in this university. I am only telling about the university, but what about our activities in Expo and health tourism? I hope in future in medical tourism, Bangladesh should come forward. Bangladesh and other countries together then can make a consortium for improvement of medical tourism in the globe, in the Southeast Asia region. I hope the hospitals like Bambuddra, the hospitals like Medanta, or any other hospitals from other countries, we can work together how we can improve the medical tourism in South Asia region. In our hospital, we are wanting to perform the robotic surgery. So robotic surgery is also going on in different parts of India also. So if necessary, in this expo, we can make a training program also. And I talked about the quality control and accreditation of hospital. You know, in our country, we have the Bangladesh Accreditation Board, but we should also include the hospitals to be accredited. And I hope National Medical Council of India, we will work together and have already talked that we can accredit it in future. Some of the hospitals who will work better, he will be number 1, number 2, number 3. In this way, we can accredit it. Yesterday, I had a talk with even General Assembly side event on biobank. Our Bongomata Sheikh Mujib Medical University, we are now capable to make a South Asia region biobank where Nepal, Bhutan, India and Bangladesh can work together along with Sri Lanka. And this biobank where there is the tissue, the cements or the umbilical cord or the blood which will be preserved, and after birth this blood will be analyzed later on when the patient will come, and his treatment, his medical research, that can be done with the help of this biobank. I think we have other thing to do. Public health. Public health should be improved. You all know in Corona, Bangladesh was in a better position for management in Corona, and public health was then flourished. And you all know in South Asia region, Bangladesh was #1 in the management, and in whole world, our position was, our Prime Minister position was 5th. I think also we should come up in the prevention of dengue. If necessary, we are trying, if necessary, there is a World Health Organization or FDA approval, we will go for vaccination in dengue. But I will request all of you to be alert to prevent dengue, to make every places clean and remove the water within 3 days where it is stagnant. I am very much grateful to be with you in this Health Expo. In future, all the hospitals, in the next year I hope, Bangladesh and other countries, not only 8, other countries will come and we will work together for the development of health delivery system, hospital accreditation, hospital improvement, training program, and development of the health professionals through symposium, training program, etc. I thank all of you for inviting me. I wish all the success of this Bangladesh International Healthcare Expo 2023. With this few words, thank you very much. Joy Bangla, Joy Bangla, long live Bangladesh.
Thank you, sir, for sharing your wisdom.